adult macular degeneration, or AMD, we might call it. It's a leading cause of blindness in people over 50. And I'm going to get into some detail about macular degeneration, and I've got some pictures to show people what it really means to their eyes and what really happens. Then I'm going to go through the National Eye Institute, which is part of the NIH, the National Institute of Health, what they have proposed and what their studies have been. Because obviously what we're doing here, my job, right, is to give you the medical side, what the data is showing, and then how does Cerule fit in? How do our products fit in to the caring for your eyes and your health? And one doesn't completely absolve the other. They work together. How can they work best together to give you the best health possible? So that's really where I'm going with this. And what I try to do every time I do this is the research that I do is what's out there scientifically that is not generated by Cerule, and then what data is generated by Cerule, and then blend them together to show you that, to discover. And what I found in my research, I found out why StemEnhance ULTRA actually, would help your macular degeneration. And there's anecdotal stories and testimonials, and I'd love to have some sent in about adult macular degeneration. But what you're going to find at the end, when I sort of the upshot at the end, which I don't want to spoil, is how it works and why it works. And that's something that it's sort of that aha moment for me when I do this research. And I spend many hours on doing this because I have to cross-reference articles and make sure that they're legitimate, and how's that fitting into something practical for you, and how, when you explain it to your IBOs, how does it make sense and translate obviously into sales. So as I said, it's a leading cause of blindness in people over 50 in the USA and many other countries. Almost 2% of people in their 50s have it, and 1/3 over 75 have it. Whites have a highest incidence, meaning the percentage, followed by Chinese, then Hispanic, and the least is African American. There's a gene linked to macular degeneration, but if your eyes are light colored, you have a higher incidence of getting the dry macular degeneration. It might be because light colored eyes don't reflect UV light as well as dark eyes. 2/3 of these patients are actually female. Sorry, ladies, 1/3 male. But mainly they think that's because females live longer. So that makes sense. Smokers are 4 times more likely to get macular degeneration. So we've talked about general health and the Cerule cycle of health since the beginning when I started here. And the Cerule products, and there's diet, exercise, being healthy, not smoking, all these things are going to contribute to your general overall health. So you can see why smoking here is really bad. And they believe that's because we know smoking reduces the blood supply to tissues, and it's going to do the same thing for your retina, which is the area that we're going to be talking about today, which is at the back of your eye. Hypertension is also linked to a higher incidence of this. And if you have a heart attack or stroke, you also have a higher incidence, as well as high cholesterol. Also, some data suggest obesity, especially if your body mass index, BMI, is over 30. There's a 2 times risk. So again, being healthy, taking Cerule products, helping. I gave a talk on obesity and how that works with adiponectin, which is this factor that is stimulated when you take Cerule products that makes your obesity get less insulin resistant. So it helps you with that. So it's important that you stay healthy. Sun exposure, hypothesized because of too much UV light. So wearing sunglasses is obviously important, especially if you have a lot of sunlight and you have light, fair colored eyes. And we're going to talk a lot about diet and ingestion of what we're going to eat. And as you probably imagine, a diet with, you need green leafy vegetables. We're going to obviously talk about StemEnhance later. And more than 3 drinks of alcohol, also higher risk. And if you obviously get macular degeneration in one eye, then you're going to have a higher incidence of getting it in the other eye. So there's 2 types of macular degeneration, dry versus wet. Dry is the most common kind. 85 to 90% of patients with it have that. It's where you have this fat and protein depositing in the back of your eye under the retina. So let me just give you a quick picture of an eye, just to kind of give you a sense of what I'm talking about here. Hope you can see that. So the retina is the part at the back of the eye, and these are the cells in your retina. And the macula is the area where is responsible for central vision. So the things that are right in front of you, that's the macula. And when you get the dry macular degeneration, these little deposits are called drusen, D-R-U-S-E-N, and you can probably see those little dots. That's a drusen in the retina. When the ophthalmologist or optometrist looks at your eye, that's what they see. So that's what we don't want to see, of course. And these drusen enlarge and your vision deteriorates, especially the central vision. About 5% of the dry ones convert to wet. After 3 years, about 15% convert. The wet usually gets worse more quickly because that's a different kind of problem. There's blood vessels growing under the retina that sort of bubble up and they push on that area, and that causes leak of fluids and visual loss. So that's the wet kind. Okay. There's many things to ophthalmologists and optometrists are looking for. They can do an optical coherence tomography, which is a 3D image of your retina. Obviously, the normal ophthalmoscope exam is important that they'll do. And they can also inject a dye, a fluorescein dye, to check the blood vessels in your retina. So early detection is very important with this disease. They can even inject a medicine, it sounds a little freaky, into your eyeball. They numb the eye first with some drops, and that can actually help. And there's laser therapy as well, like a photodynamic therapy where they give you dye in your vein. It goes to the retina, then the laser shines, and it can seal up those leaky blood vessels. So there's these other more advanced treatments. But what we're really going to focus on today is two really big studies that were done, that were coordinated by the American Eye Institute, called AREDS, A-R-E-D-S, or Age-Related Eye Disease Study. There was AREDS, the first one, and there was AREDS 2. And AREDS had beta-carotene, vitamin C and E, zinc, and copper. And the AREDS 2 had lutein, zeaxanthin, and omega-3 fatty acids. So we're going to get a bit into the differences between the two and why these are important to Cerule and vice versa. So let's look at that in some detail. Sorry. So the ARED study was a clinical trial. They actually had about 4,000 patients in each study. And these, you can buy actually AREDS vitamins and supplements, but which is fine if your doctor and ophthalmologist suggest and recommend you take an AREDS vitamin, that's great. But, and that's fine, obviously. But what I'm going to show is that you, in addition to that, I think my recommendation would be taking StemEnhance ULTRA as well. So I'm going to get to that point. But these studies were quite long. In fact, they were an entire decade. So the data is pretty reproducible, which shows that these vitamins and minerals, these things here, were helping patients. They had about a 25% reduced risk of developing macular degeneration, particularly with the AREDS 2 trial. So, and the AREDS 2 trial, by the way, was around 2007, 2008. So it's a little bit older, but it was a decade of studies. So it's quite reproducible, and these results of improvement of vision had gone on for years. So, and what they're saying is that diets rich in green leafy vegetables are a good source of lutein and zeaxanthin. And the zeaxanthin is actually in your retina. So, and these products or molecules are metabolized there and used there. And so they have a lower risk of developing adult macular degeneration if you have a good source of lutein and zeaxanthin. So I want you to remember that in a few minutes. Again, with these, you got a 26% reduced risk now of developing a progression. You can't get rid of macular degeneration with this, unfortunately, but you can slow the progression of it. So I think that's really important. And if any of you are interested in what the AREDS actual data was, I'd be more than happy to I'll post that actually on Facebook on the next day or so. And it does break down the values for each one of these and what were recommended. There's some caveats because in the AREDS first study, beta-carotene in patients that smoked had a higher incidence than people who didn't smoke of lung cancer. Now, of course, smoking gives you higher incidence of lung cancer anyway, but if you're taking beta-carotene, there's some increase in lung cancer. So people who were smoking couldn't go into this study. They would later on could go into this study. So just so you know that's a sort of a warning flag about the ARED study in terms of the beta-carotene. So lutein, zeaxanthin, and beta-carotene belong to nutrients known as carotenoids that are made by plants and enriched in leafy green vegetables. And beta-carotene is used to make vitamin A, which is required by the retina to detect light and convert it into electrical signals. Beta-carotene itself is not found in the eye. In contrast, lutein and zeaxanthin are found in the retina and the lens, where they may act as natural antioxidants and help absorb damaging high-energy blue and ultraviolet radiation. So I'm going to say that sentence again. Lutein and zeaxanthin are found in the retina and lens, where they may act as natural antioxidants to help absorb damaging high-energy blue and ultraviolet light. So that's a very important statement. During the AREDS trial, 2 large trials funded by the National Cancer Institute found that beta-carotene, I mentioned, can increase lung cancer in people who smoke. So that's the red flag I was talking about. And with the AREDS study, there was an increase or an 18% lowering of progression of this disease in that study. Omega-3 fatty acids are made by marine algae, as we know, and enriched in fish oils. They're believed to be responsible for health benefits. And we're going to obviously, we know that's the marine algae is what Cerule is all about. And they particularly focused on DHA and EPA, the 2 omega-3 fatty acids. They said they're needed for the integrity of the retinal cells and have been shown to promote retinal development and repair in previous studies than the ones I'm referring to. So they go through the dosing of these different ingredients, and there's some modification of the dosing over time. There are some issues with zinc and with copper. So this pilot study certainly was very reliable, but it turns out that this one here, the second study, is something that people are going more towards. Let's see. And then there was a concern about the high dose of vitamin E. So because if you take high dose of vitamin E, there's a potential risk for prostate cancer. So that's something, if you obviously have a high PSA and some issues with potential prostate cancer, you don't want to also be on this study because there's vitamin E. So you have to be careful if you have that issue. And these studies were funded by the National, as I said, Eye Institute and the Division of Epidemiology and Clinical Applications. 82 sites actually were involved with the AREDS 2 studies. So that's unbelievable. There is questions about will AREDS formulation help prevent cataract? They haven't seen any improvement with the potential of cataracts, although they further said the patients in AREDS 2 who took formulation, including their nutrients, had an average of 32% reduction in progression of cataracts, so to cataract surgery. So people who had cataracts, the ones that were going to get worse and potentially need cataract surgery, they were less likely to go to cataract surgery if they were taking these products in the AREDS 2 study. So obviously there is some benefits in taking that for cataracts as well. Then there's always a question about genetics. They don't believe that there's a genetic, well, they don't know about the gene coding for this specifically. So it is hard to say if somebody has, your parents have this, that you would necessarily get that. There's no direct correlation with one particular gene. And then, so as I mentioned, the lutein and zeaxanthin were important in the retina. So what I found was that there's a paper, The Effects of Fucoid from 5 different brown algae on oxidative stress and VEGF interference in ocular cells, in eye cells. So this is an in vitro study, so in a lab with retinal cells, cells from the retina. Cell lines were protected from oxidative stress with brown algae. They reduced VEGF, which is vascular endothelial growth factor, meaning the factor that can make blood vessels grow too much in your retina, which you don't want, and the secretion of RPE, or retinal pigment epithelium. So they took the cells from the pigment of the retina cells, and tested that. This factor, which we don't want, the VEGF, which is what causes the blood vessels to overgrow in the retina, so reducing VEGF is a positive thing. We want that. This means that abnormal blood vessels in the macula will be diminished. Since fucoidin is in StemEnhance ULTRA, so here's a direct correlation of SEU helping this disease. To state it more simply, retinal cells in vitro, as in life, produce a chemical factor called vascular endothelial growth factor. This factor is bad, as it causes abnormal blood vessels to grow in the retina. Fucoidin, which is in StemEnhance ULTRA, reduced the amount of vascular endothelial growth factor made by these cells. Thus, SEU can improve macular degeneration. So there's a very interesting finding that sort of took me a while to sort through the data and try to figure out how this works together and why clients, patients, IBOs are saying that their macular degeneration is getting better on StemEnhance. This is one paper that makes that connection. That was in an article by Dorschman in Marine Drugs 2019. And again, I'll post this paper. The second article was then I researched a long but interesting article by a fellow named Takaichi. I believe it's from Japan. It's again in Marine Drugs 2011. And the title is Carotenoids and Algae, Distributions, Biosyntheses, and Function. I discovered that cyanophyta contains zeaxanthin, which the ARED study says improve macular degeneration. So cyanophyta also produce lycopene, which can lead to lutein production, which also improves macular degeneration. So what I found was that, wait a minute, there's the cyanophyta, which is in SEU, right? It says contains zeaxanthin, and that they also produces a precursor to lutein called lycopene, which makes lutein. So both of these things are being produced by StemEnhance ULTRA. The effects are causing this, which again leads to improvement in adult macular degeneration. So the next step was to find out where cyanophyta is in Cerule products. So then went back to an article by Hart and Gita Jensen 2007 called Natural Killer Cell Activation, etc. And lo and behold, which says that SEU contains AFA, which is derived from cyanophyta. So we've got papers that were completely disparate that Cerule was doing on their own and doing great research, especially obviously Gita Jensen's work. And then other people were doing work that had nothing to do with Cerule. But what I found was that if you dig deep enough and you really know where to look, and you spend the time, you can hopefully find these kind of connections. So again, I will post both of these papers. So that was really important to find that there's a connection between SEU and improved vision with both lutein and zeaxanthin to help adult macular degeneration. So what's the bottom line here? So the Mayo Clinic recommends if your vision seems fine, get your eyes checked every 5 to 10 years if you're in your 20s and 30s. Every 2 to 4 years, ages 40 to 54. Every 1 to 3 years from 55 to 64. Every 1 to 2 years after 65. If you have any signs of adult macular degeneration, your eye doctor will, of course, give you instructions about checkups that most likely will be more frequent. So eye exam's key. If you have any belief that your vision is deteriorating, you need to get an eye exam, please. If you are known to have adult macular degeneration, ask your doctor which ARED supplements are right for you. Talk to your eye doctor about the fact you're taking or want to take SEU. Let him or her know that there is evidence that SEU leads to production of zeaxanthin and lutein, both of which are in the AREDS 2 study. My feeling, now I'm not an ophthalmologist, of course, after reading these studies, is that if I had adult macular degeneration, I would talk to my eye doctor and advocate to take SEU along with AREDS protocol supplementation. If for some reason you do not want to or cannot take ARED supplements, you should at least take SCU. I mean, that seems totally logical to me. Again, none of these products, including AREDs and AREDS2, can prevent or stop adult macular degeneration, but they can slow its progression according to these ARED studies. So that's the part about macular degeneration, and I will be sending that information out.